Aşı ne
Aşı,
zaman piyasaya
evet,
çıkacak? En çok
evet,
merak edilen soru bu aslında bütün dünyada. Aralık dendi, Kasım dendi, Dünya Sağlık
evet,
Örgütü tarih verdi. Sürekli tarihler değişti. En son
evet,
güncel sizin gördüğünüz tarihi
evet.
sizin ağzınızdan duyarsak hoş olabilir.
Şimdi bizim çalışmalarımız daha faz 3'te ve faz 3'ü başarıyla bitirebilirse eğer Kasım'ın ikinci yarısında EMA ve FDA'ya dosyalarımızı yollayacağız ve dosyalarımızı e, 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 en azından bir ay EMA ve FDA ile görüşülecek ve soruları varsa eğer onları cevaplandırmamız lazım. FDA ve EMA dosyaları ve çalışmalarımızı olumlu görürse eğer Aralık'ın son günlerinde aşıyı e, Avrupa veya Amerika'da dağıtmayı e, belki onaylayabilir. E, Bu ama ilk birkaç milyon doz olur ve 2021 Ocak-Şubat ayında Avrupa'ya ve Amerika'ya aşılarımızı dağıtmaya başlayabiliriz. 6. aya kadar en azından 200-300 milyon doz aşı dozu dağıtmak istiyoruz. Ama tabii bunlar tek başarılı olursak olabilir. Türkiye Sağlık Bakanlığı'yla da görüşüyoruz ve Türkiye Sağlık Bakanlığı'yla eğer birliğine başlayabilirsek ve bir protokol bulabilirsek belki e, e, 2021 Ocak, Şubat, Mart aylarında Türkiye'de aşı dozları getirmeye imkanı olur.
Kaç doz olur Türkiye için eğer her şey mümkün olursa? Kaç doz düşünülüyor?
Bunu Sağlık Bakanlığı ile görüşmemiz lazım. Sağlık Bakanlığı bizden kaç doz istediğini söylemesi lazım ve ne zaman dozları gerektiğini söylemesi lazım. Onları öğrendikten sonra biz de yeterince doz Türkiye'ye ayırmak isteriz tabii. We have clinical trial participants in the United States, in South America, in Europe. And we recently started also the phase 3 trial in Turkey, sometime in the coming 10 days. And if this first evaluation is positive and shows that the vaccine has an efficacy, we plan to submit our documents in November. This means this month, which could result in interactions with EMA and Pfizer until the end of this year. So we are going to ship our vaccines at minus 70 degrees using also dry ice. And if the vaccine arrives at the vaccination center, it can be stored in the vaccination center also at minus 70. But if it is going to be used, it can be taken from the minus 70 and just put into the fridge. Yeah, so at 4 degrees in a normal fridge would be okay. And then within 5 days, the vaccine has to be used, which should not be a big challenge, because in the pandemic situation we will have people lining up and waiting to get the vaccines at the vaccination center. In the later phase, we expect to have a more stable formulation, which could help us to keep the vaccine in the fridge for much longer time and enable transportation of the vaccine also to pharmacies or to physicians. So our plan is to manufacture up to 1.3 billion doses in 2021. We have agreements with the United States, with the European Union, with Canada, with Japan, and with United Kingdom for supplying vaccine doses. And we have also a collaboration with China. Yeah, and will supply vaccine doses to the China region. We have also acquired a new vaccine manufacturing site in Marburg in Germany, which could allow us to further increase the manufacturing of vaccine doses. If we calculate that we want to produce 1.3 billion doses together with our partner Pfizer, that would mean that per month we would produce at least 100 million or 110 million doses per month. And it is important that the vaccine is made available not only for the rich countries, but also for the economically low-income countries. And this is something which is discussed at different levels. For example, at the COVAX initiative has the goal to enable, in collaboration with the World Health Organization, to make the vaccine available to all regions worldwide. Working together with a number of vaccine companies, we expect that if vaccines are successful, there will not only be one vaccine, but there will be many vaccines. So companies like AstraZeneca, Moderna, BioNTech, Glaxo, Sanofi will come in the next 6 months, and together we may be able to produce many billion of doses, which could help us to make vaccines available worldwide until mid of 2022. Yeah, so that's the time plan where I believe that the whole planet could be supplied with vaccines. It is important for assessment of safety and efficacy to perform large clinical trials. So our trial is one of the largest worldwide COVID-19 trials, as already mentioned. We have enrolled more than 40,000 participants so far. It is a double-blind study. That means half of the participants receive vaccine, half receive the placebo. Our trial so far has not shown any vaccine-related severe effect, so that the trial continued, and based on the data that we have seen so far from this blinded data, the vaccine seems to be well tolerated, and we expect that the vaccine induces the classical vaccine-associated side effects. So that means some participants may get fever. So we expect in the range of 15% of vaccinated people to have fever for 1 day, which is mild and moderate, and this vaccine effects are usually gone after 1 or 2 days. So this is one important assessment, the safety, which is crucial. The second is efficacy. That means the question is if the vaccine is able to prevent infection in the vaccinated participants. It is indeed important that the vaccine induces strong immune responses. So there are 2 types of immune responses. It is the antibody response, particularly antibodies which can inactivate the virus. These are called neutralizing antibodies. Yeah, we have seen in our phase 1 study that our vaccine is able to induce strong neutralizing antibody responses. The neutralizing antibody responses were much higher than the antibody response which is induced by the disease itself. So this is very encouraging. What we have also observed is T-cell responses, and these T-cell responses are important to reduce the severity of the disease if someone is infected. And we see strong T-cell responses. So we believe that our vaccine, based on this data, could be able not only to prevent infections, but if someone got the infection to also enable that the disease is less worse. We have to test that, and the data will show whether this is the case. But this type of immune responses are of crucial interest. Some patients with COVID-19 has only little amount of antibodies or no antibodies, and it is expected that these patients have only limited immunity. And limited immunity means that the patient can still get infected, yeah, but might have less severe disease. And therefore it is important that we have vaccines which are able to induce neutralizing antibodies. And I'm completely with you that an excellent vaccine should come with both, with strong neutralizing antibody responses as well as T-cell responses. Only in combination with both we can ensure to stop the pandemic situation. Otherwise, we would just have vaccines that might prevent severe disease but not prevent infection. The type of vaccine that we are developing is called messenger RNA vaccine. Messenger RNA vaccines are using genetic information of the virus. It's a piece of information which can't induce an infection. And this type of vaccine is new. It is not yet approved. So there is based on an innovative new technology. We believe that this technology has a number of advantages compared to existing technologies like viral vaccines or recombinant protein vaccines. So the key advantage is that the development time is faster. A second advantage is that it is easier to produce many million or hundreds of millions of doses of vaccine in a short time. Another advantage is that the vaccine is very precise. So we are inducing an immune response only against the virus, but nothing else. And this would help us to allow us also to do booster vaccination. So we don't know how long a vaccine response is active, but if we would see that after 1 year the antibody titers would go down, we could just use the same messenger RNA and revaccinate. This revaccination and boosting of the immune response really works well with messenger RNA. Messenger RNA vaccine uses genetic information, but the genetic information is based on a nucleic acid RNA, which is rapidly degraded. It is not integrating into the human genome. So the messenger RNA even don't reach the nucleus. Yeah. So therefore it is an extremely scientifically safe approach. Yeah. So that means the message is like an information which is after a few days completely deleted. Yeah. And the human body has no genetic change. So this is different from DNA approaches, where the genetic information might enter and could become integrated into human cells, which is not going to happen with messenger RNA vaccines.